Hi, my name is Maggie Moore, and I am a therapist at Eating Recovery Center and Pathlight Mood and Anxiety Center. And I am happy that you have logged on to listen to the presentation, What's Treatment Really Like? An ERC and Pathlight presentation. So in the next bit of time that we share together, I will walk you through what to expect if you or a loved one that you are supporting are considering higher levels of care at Eating Recovery Center or Pathlight Mood and Anxiety Center. And before we jump into the presentation, just wanting to acknowledge that some of you are on this call because you yourself are interested in going to higher levels of care at ERC or Pathlight. And some of you are on this call because your loved one is interested in going to a higher level of care and you are here to support them through the process. So regardless if you are here for yourself or for someone that you are supporting, this information will give you an overview of what to expect. So wanting to kind of give a roadmap of where we will be going with this presentation, this is the agenda. So we will be talking about, what is ERC and Pathlight? What are the differences in levels of care? Who is on the treatment team and how will they help? What does a typical day look like for our patients in programming? We'll answer the question as to whether family and friends are involved in treatment, talk about what you can expect through that admissions process, and then reviewing how we support our patients after they continue on their treatment and recovery journey and discharge from ERC and Pathlight. So that is how we will spend the next bit of time together. And as we jump right in, wanting to, answer the question, what is ERC and Pathlight and who are we? So already you've heard me refer to Eating Recovery Center and ERC. So those one of the same, referring to our same treatment program that supports those who have been diagnosed with an eating disorder. And then we also have a program called Pathlight Mood and Anxiety Center for those who have been diagnosed with a mood, anxiety, and trauma-related disorder. And so ERC and Pathlight are a national leader in eating disorders as well as mood, anxiety, and trauma-related disorders. We offer specialized care at all levels of care, including inpatient, residential, partial hospitalization, and intensive outpatient programming. Later in the presentation, I will talk more specifically about those levels of care. And so we offer in-person care across 37 treatment centers across the country, as well as virtual treatment for our intensive outpatient program. So wanting to kind of give that framework as we jump right in to talk about, what you can expect from higher levels of care at ERC and Pathlight. So this slide here highlights kind of what you can expect from the assessment phase to the time and treatment to aftercare. So we kind of think about them kind of in this continuum as displayed by the slide, with the beginning being that assessment phase. That's the time that you are gathering information, considering options for entering into a higher level of care to get the specialized treatment that you need. You will work with the ERC and Pathlight admissions team to determine what is the right level of care for you. And then after that assessment phase, our patients will move into the treatment phase. And that is when they will be receiving programming through our specialized treatment centers of ERC and Pathlight, working with at all levels of care, moving through the continuum of care in a gradual supportive step-down process, where we use evidence-based treatment to support our patients. And then stepping into that aftercare phase, once our patients have moved through their treatment experience and they're continuing on their treatment and recovery journey and stepping down to lower levels of care and discharging from ERC and Pathlight, we provide ongoing support through alumni and aftercare resources, both for our patients as well as for their family and friends. So that's kind of a roadmap as to what to expect from the assessment process all the way through the aftercare services. So now we're going to talk a little bit more about each of these phases of treatment, starting with levels of care. So for mood anxiety treatment and eating disorder treatment, we have levels of care that determine the amount of intervention and support one receives for their diagnosis. So if we think about levels of care kind of in a stair-step fashion, as this slide shows, with those highest levels of care being at the top, and those higher levels of care being inpatient and residential. Inpatient is specific to our eating disorder program at ERC, and residential is offered at both ERC and Pathlight. So at that inpatient and residential level of care, our patients are staying 24 hours a day, 7 days a week at our treatment center to provide intensive support and care for their eating disorder and mood and anxiety disorder. It's an opportunity for our clinical, medical, and dietary team to provide 24-hour care and intervention. It's also an opportunity for us to really kind of provide containment so that our patients can focus on being in treatment, getting back on track with their meal plan, interrupting any maladaptive behaviors, and really focusing on, well-being. Stepping down from inpatient and residential level of care is what we call partial hospitalization program, PHP for short. And you can think of PHP as being day treatment, in that our patients are going to programming throughout the day and then living independently in the evening, nighttime hours. So a pretty significant amount of time spent in programming during the day where they're getting support from the treatment team and support from our programming, while then having that time of independence in the evening and nighttime to see what is coming up for them. If they're having increased thoughts in using eating disorder behaviors, if they're acting on self-harm behaviors, and to see what is coming up for them to then go into programming during the day and to get the support from the treatment team and the structure. And then stepping down from PHP is what we call IOP, Intensive Outpatient Program. So at the IOP level of care, a patient is going to treatment 3 hours a day, 3 days a week. So it's a wonderful opportunity for our patients to be engaged in their life, to go to school, go to work, whatever life looks like for them, while still getting the support of the treatment team and the programming 3 hours a day, 3 days a week. At ERC and Pathlight, we offer both in-person IOP, where a patient is going into our treatment center and meeting face-to-face with the treatment team, as well as virtual IOP with our at-home program, where our patients can, from the convenience of their home or wherever life is for them, they can log on to the secure platform to receive the care in that virtual setting. So the big takeaway from this slide is the importance of completing all levels of care in a gradual step-down process so that we can support kind of a smooth transition as our patients are moving through those levels of care and getting to a place where they step down and can start incorporating all of the skills that we're learning and programming into their life. So now we're going to talk about the multidisciplinary treatment team. And so what that means is we have a number of clinical, medical, and dietary providers all working together, communicating and collaborating with each other to provide the care our patients need. So this slide highlights specifically who is on the treatment team. And so first being the psychiatrist. So if medication management is part of a patient's care plan, then the psychiatrist will do all things related to medications, making any recommendations, adjustments as needed. And then the medical doctor is there to provide kind of that medical support from that medical lens. So, reviewing labs and making any medical recommendations as needed. And then the primary therapist is there to provide that one-on-one therapy with the patient and therapist, as well as the family therapy with the therapist and the family and friends who are involved in treatment. Then we have the registered dietitians for those who have been diagnosed with an eating disorder and in our ERC program. So the registered dietitian is working one-on-one with each of our patients for that nutritional rehabilitation. So developing a meal plan that supports their nutritional needs and helping to interrupt eating disorder behaviors and get them back on track. And then the care coordinator. The care coordinator is somebody who can help support kind of with all the administrative tasks that can come with treatment. For example, they can help communicate with the place of employment of our patients if FMLA paperwork needs to be submitted or schoolwork needs to be submitted to the school. The care coordinator can help with that. They can also help to ensure outpatient appointments are set up when it's the time for discharge from our patients. And then the behavioral health counselors. The behavioral health counselor is there to really support our patients who are on site with us by providing as needed coping skills in the moment, or they are there to help facilitate groups. So they're really there kind of to help in that moment to moment and day-to-day support of programming. So again, this multidisciplinary treatment team is set up so that our patients are getting support from a number of care providers. And again, everybody will be collaborating with the other treatment team members, with the patient, and with the family and friends who are involved to make sure that everybody is on the same page, working towards the same treatment goals with our patients. So now we're going to take a moment to talk about, what are our programming components? What makes up the day of programming for our patients? So certainly not an exhaustive list as shown by this slide, but the key components that each of our patients will engage in while they're at ERC and Pathlight. And wanting to make note, no matter what level of care our patients are in, inpatient, residential, PHP, or IOP, there will be aspects of all of these programming components at all levels of care. So the first one being individual therapy. So that is the time where the therapist and the patient are meeting one-on-one to be able to develop rapport and trust, to talk about and process through what is coming up for them now that they're in higher levels of care and that they have interrupted their maladaptive coping skills. It is a time to really identify what are the maintaining factors of the eating disorder. What is the reason that somebody's engaging in maladapting coping skills? And a time to really plan for the next steps, to identify, who is on the support team for our patients? What are their coping skills that they will use? And how will they continue on a recovery-focused path after they have discharged from ERC and Pathlight? And then group therapy and education. So there's a lot of research that highlights how effective group therapy is when working with those diagnosed with an eating disorder or mood anxiety disorder. So the group therapy component is an important part of our programming. And so it's, as you could imagine, a small group setting of patients that's facilitated by a therapist. The groups can be skills-based, they can be process-oriented, and it's a time for our patients to come together and to connect and empathize with others. And there's also an opportunity for that peer support and peer accountability. And then family therapy and education. So at ERC and Pathlight, we really value family, friend, and caregiver involvement by providing resources, support, and family therapy. So there are opportunities for family members and friends to be a part of the program through family therapy, through parenting caregiver groups, and many different opportunities for our families to learn more about eating disorders and mood and anxiety disorders. And then medical management. As mentioned earlier, our medical team is there to provide support from that medical stance as needed. And then nutritional rehabilitation. So for those who are in our ERC program, an absolute priority of the program is that nutritional rehabilitation. So the time that registered dietitian is working one-on-one with each patient to develop that meal plan that, supports those specific needs of each patient's eating disorder, and to come up with a plan that challenges the eating disorder and helps our patients to build confidence and competency that they can do things related to their meal plan. And then experiential activities. That is the time when we incorporate mindfulness, gentle movement, yoga. So ways that we can provide therapeutic support through these experiential activities. So again, as mentioned, all aspects of these programming components are incorporated into our patient's treatment schedule. And then we briefly touched on family and therapy involvement and mentioning how ERC and Pathlight absolutely takes the stance that we want to support and educate and involve our family, friends, and caregivers. So this slide highlights the number of ways that family friends can be involved in this process. So the HOPE orientation is an orientation for family and friends to learn what to expect as their loved one is in programming at ERC and Pathlight. And then the virtual family and friends education series. So these are weekly virtual presentations where our clinical, medical, and dietary leaders present on topics related to eating disorders and mood and anxiety disorders and how our family and friends can support their patients. So a great opportunity for that educational aspect of our family therapy approach. And then we offer family and friends virtual caregiver support groups. So this is a time where we have our ERC and Pathlight facilitators provide a space for caregivers to come together in the virtual setting to talk about the successes, the challenges that are coming up for them as they're supporting their loved one in their treatment and recovery journey. So a time to really connect with others. And then we offer the Eating Disorder 101 and 201 virtual presentations on Saturday mornings. So as the title suggests, it's an opportunity for people to learn more about eating disorders. And then we have the aftercare planning session. So these are virtual presentations that help prepare our family and friends for when it is time that their loved one is moving through the levels of care and stepping down and discharging from ERC and Pathlight. So really providing practical skills to our family and friends of how to support their loved one after they have discharged from ERC and Pathlight. So again, the takeaway being how much we want to offer support, education, and resources to our family, friends, and caregivers because we know how important it is for family and friend involvement for our patients' treatment and recovery journey. So now we're going to kind of switch gears and talk specifically about what a patient or their loved one can expect during that admissions process. So, coming to the time where, an inquiring patient and their family and friends are, contacting ERC and Pathlight to start the process of seeking higher level of care. So this slide highlights how we make sure that our patients get support every step of the way of that admissions process. So we have the clinical response specialist, the clinical assessment specialist, the patient access coordinator, and the admissions coordinator. So these are all members of our admissions team who are going to be there to gather data from the patient and the family to determine the level of care that is being recommended. It is a time for our admissions teammates to answer any questions that our patients and their families have about treatment, and for them to be able to, walk step by step with the patient and the family as they're moving through that admissions experience. So again, wanting it to be known that we recognize that when somebody is seeking higher level of care, there can be a lot of emotions and logistics to figure out. And just know that ERC and Pathlight has a comprehensive admissions team to support every step of the way. And then recognizing that insurance can be, a component to our patients receiving the care that they need. So wanting to take a moment to talk about, does insurance cover treatment and what to expect from that aspect? So first of all, we are a network, with most major insurance providers nationally. And we recognize that insurance can be kind of an overwhelming thing, which is specifically why we have ERC and Pathlight teammates who are the experts in insurance and serve as the liaisons for our patients and their families and their insurance companies. So our ERC and Pathlight insurance teammates will be working directly with the patient's insurance company to advocate for coverage and care. And wanting it to be that our patients and our families can really focus on the time at higher level of care and in treatment. So we will work as that liaison to communicate directly with the patient's insurance. So now talking a little bit about how it is that we support our alumni. So those patients who have discharged from ERC Pathlight, we refer to as alumni, how we support our alumni and their families and friends through our aftercare resources and services. So this slide highlights the number of ways we provide continued support. A couple things that I really want to point out is that we provide events for our alumni. So a time for alumni to come together in a supportive environment, whether that be in-person events or virtual events, to be able to have connection with others. Then we have the Mental Note podcast. So this is a podcast that offer hope-filled episodes talking about the mental health community. So anybody can access these Mental Note podcasts wherever one listens to podcasts. And then we offer over 20 free virtual support groups. So I think this is such an incredible offering for our alumni because such an important factor of recovery is having a community, having connection with others. And our free virtual support groups serve just that. Some of our support groups provide general support for eating disorders and mood anxiety disorders. And then other virtual support groups that we offer are more specific to a cohort. For example, we have a college age support group. We have a BIPOC support group. We have an LGBTQ plus support group and many other support groups for our alumni to get that connection and support with others. And then we provide continued connection with our alumni through our alumni and community outreach liaison. So these are a group of ERC and Pathlight teammates who are here to provide ongoing support to our alumni and their families by offering those in-person and virtual events, by offering the virtual support groups to be a point of contact back to ERC and Pathlight for our alumni, to provide ongoing follow-up and connection and check-ins through email communications, through phone calls. So really a team that is there to support our alumni and their family and friends through ongoing resources. So we are coming to the end of the presentation. And so at this point in time, just really wanting to highlight, what it is that you can do in terms of next steps and reaching out to our admissions team. So our teammates on the admissions team are there to support you as you are navigating the next steps, to answer any questions, and just to be that support team as you are engaging in the process of entering in the higher level of care. And so you are able to schedule a free consultation, no obligation, to be able to gather information and to get your questions answered by our admissions team. So if you're ready to take the next steps, we encourage you to reach out to our admissions team to be able to schedule a call to talk with them. So with that said, we will conclude there. And I want to end by just highlighting how brave it is for all of you, whether you are here listening for yourself or you are here supporting a loved one, how brave it is for you to be considering higher level of care and taking those next steps to support your health and well-being, and really wanting to acknowledge what that is and represents for you. So with that, thank you so very much. I appreciate you taking the time to listen in.